Hi, good morning, everyone, and good evening, good afternoon from various parts of the world. We are live on 83rd CIMAO meeting, which is International Weekly Meeting. This is the 83rd session, and we are on 6th of November, 9:30 a.m. live. We have been doing this session for the last many years now, and it is our always efforts to bring knowledge and various views of different associations. And we also have invited guests with us, and we share country experiences, we share CIMAO experiences, we share COVID experiences, a journey which was started by Dr. K.K. Agarwal. Today, we are talking about COVID-19 country experience for Canada. This is the first time Canadian Medical Association has been representing on this forum. So thank you so much. And meanwhile, till the time people will join, we will start the presentation. I will just briefly tell you, CIMAO is basically a consortium of almost 19 countries, and which includes Australia, Cambodia, Bangladesh, Hong Kong, China, India, Indonesia, Japan, Korea, Macau, Malaysia, Myanmar, Nepal, Pakistan, New Zealand, Philippines, Singapore, Sri Lanka, Taiwan, and Thailand. And with this, we also have a special guest, usually from World Medical Association, who will be joining very soon. I would like to introduce Dr. Jeff Blackmore. He's from Canada, especially here for the presentation. He's the Executive Director for Canadian Medical Association. He's the Executive Vice President, Global Health and Chief Medical Officer. He's also the Assistant Professor in University of Ottawa. And we would like to hear from him the Canadian experience. Over to Dr. Jeff. Dr. Jeff, this meeting is also live on our social media platform. We have about 2 million subscribers. This base is, which was started by Dr. K.K. Agarwal, who was the president of CIMAO last year, and we lost him during the COVID. So this session is all live in that platform, and we will introduce all those other guests once the presentation is over.
Thanks so much, Saurabh, and thanks again for the kind invitation to be here tonight. It's a little bit after midnight where I am. We're all on different time zones. One of the ongoing challenges with virtual meetings during the time of COVID, but great to be here and share the experience and some of the learnings that we've had in Canada. I'm just going to try and share my screen here.
Sure.
Now, do I need, let's see, that might work. Can you just let me know, can people see that?
Yeah, absolutely, it's fine.
Okay, terrific, thank you. So again, many thanks for inviting me here tonight, and certainly won't talk for too long and leave time for questions and discussion. But I wanted to give you a little bit of an overview of some of the things that we've encountered in Canada and some of the priorities that we've worked on from the perspective of the Canadian Medical Association. As Saurabh said, I'm the VP of Global Health, the Chief Medical Officer, and have been involved in most of the work that we've been doing in this area. And I suspect that a lot of this will be very familiar to you folks. I know through many conversations with colleagues around the world, there's certainly a lot of overlap in terms of the issues that we've been dealing with and the problems that we've been facing. So I'm going to talk a little bit about some of the early issues and challenges, and then I've sort of divided it up into talking about what we've done to try and support our colleagues, some of the issues around the transition to virtual care, what we've been trying to do in terms of keeping the public informed in an ongoing and accurate manner, some of the issues around the rollout of vaccines and ongoing issues in that area, a little bit about funding and some of our activities from a global perspective, and then finally, communications and social media. So as we all remember, and not necessarily fondly, the first weeks of this pandemic were a very difficult and often confusing time. Back in January, when the early reports started to come out about a virus in China, we fairly quickly struck an internal working group. Many of you will remember that Canada was really severely affected by SARS many years ago, and had a number of deaths, and a number of physicians unfortunately succumbed to SARS. And so we were pretty sensitized to early warning signals about a possible pandemic virus. So fairly early on, we struck an internal working group. We didn't think it was likely at that point that we would be impacted, but we certainly thought it was a possibility. The CMA was actually relatively well equipped for working from home. We've been working virtually, at least part-time, with most of our staff for a few years, and so we felt fairly ready for that transition in case it had to happen. And then a few weeks later, sometime around mid-March or so, as in many parts of the world, the country really shut down almost overnight. We went fully virtual from the office. We have about 300 employees, and we asked them all to stay home to work. A huge impact on the medical profession, of course. In-person medical visits really were reserved for emergencies only. A lot of our colleagues essentially closed their offices, and COVID numbers started to climb quite quickly in North America around mid-March. Some of the early issues that we had to deal with in Canada, again, very similar to the experience elsewhere. Personal protective equipment, lack of PPE was a huge issue. Very little stockpiled. Like many countries, we had gone to a just-in-time delivery system with a global supply chain, and so we had very little domestic capacity to try and make up the difference when supplies started to run short. We had lots of situations where physicians and other healthcare providers were reusing equipment that was really meant for one-time use. We had stories of nurses, wearing garbage bags instead of hospital gowns. Lots of other really unfortunate situations where the lack of PPE was really interfering in patient care. Like many of you, we tried to work with our federal government and other decision makers to try and procure PPE for our colleagues for the front line. Every single country in the world was in the same situation, and we were all fighting for the same supply chains. At the same time, we were faced with situations where people online were extorting vast sums of money for PPE, and unfortunately some clinicians and some hospitals were having to pay the price in some of those situations. So that was a major priority early on. We did a fair bit of work with our members as well to try and get a better sense of where the shortages were most acute and what we could do to help with that. One of the first things I was called on to do, I have a background in medical ethics, and the early reports out of Italy, as we all recall, were extremely troubling in terms of some of the heart-wrenching life and death decisions that were being made around triage and who would get access to life-saving and sustaining interventions. And so really not knowing what the situation was going to be locally, as the virus moved around the world, we wanted to be prepared for those eventualities as well. And so we drafted some triage protocols to help physicians with decision making. I think one of the real challenges and frustrations for all of us during those first few months was this concept of, in many cases, leading in a vacuum. Very little information or accurate information about the virus, a lot of uncertainty, trying to provide support to our colleagues, to patients amidst a lot of that confusion, and unfortunately, of course, a lot of misinformation as well. And so some of the early things that we tried to do in the early days were really to sort of undertake some online campaigns aimed primarily at patients and the public in those areas where we did have information. So to stay at home, to social distance, to wash your hands, personal hygiene, disinfecting, not touching your face, all those types of things, looking after each other, staying connected with family and loved ones. But even at this point, there was a lot of uncertainty around the use of masks, whether those should be reserved for healthcare providers only, whether they should be worn in public. And so trying to keep up with the evidence and learning from our colleagues in other locations was one of the challenges at that time. We tried to keep in close touch with members to share the information that we did have and what we were learning from other locations. And we undertook regular emails to them with just-in-time information as those details emerged. So you can see here as an example, 5 things to tell your patients about preventing the spread of COVID. So those were some of the things that we were trying to do in the early days while we were still trying to figure out exactly what it was that was going on. One of the consistent priorities for the organization, and I would say certainly for a lot of folks in society as well, is this idea of ongoing support for physicians and healthcare providers. I know this in some parts of the world has not been as prominent. I know in some parts of the world, physicians and healthcare providers at times have been seen as vectors of transmission, have not been as widely supported. We've certainly tried to work with politicians and the public to make sure that people do understand the role that healthcare providers are playing, the sacrifices that they're making, and the importance of supporting the profession. We've tried to do our part, of course, as a member association on a variety of fronts. So one of those is just, the clinical tools and products to provide up-to-date information for clinicians, peer-reviewed and scientifically accurate information. We have a for-profit branch that does our leadership training and our clinical products and services called Jewel, and journal, the Canadian Medical Association Journal, and we've leveraged those resources to provide constant and ongoing updates to the tools and products from a clinical standpoint. We've also recognized, as you all have as well, the impact on physician wellness. This was already an area of concern for all of us prior to this pandemic, recognizing the epidemic of burnout in the medical profession, the stress that our colleagues are under, and COVID certainly has made that worse in almost every respect. And so we put a lot of resources into mental health and wellness for our colleagues. We've established a 24/7 support line, wellness connection platform to bring physicians together. We've established a physician wellness hub where we have all the resources and tools in one location. And then consistently over the last year and a half, we've undertaken podcasts and seminars and published tools to help with those issues of mental health and wellness. We still recognize that more needs to be done. This continues to be an area of priority for us where we continue to put a lot of resources. There's no question that the pandemic has taken a toll on physicians, on nurses, on other frontline providers. We've seen retirements. We've seen people leaving the profession. We've seen people taking time off to look after themselves. And of course, all of these things make problems worse because then there are less resources to go around. Another issue that we've dealt with as well, as I mentioned quite early on in the pandemic, most physicians really had to close their offices. And that had a really significant financial impact, not just on physicians, but on the people that they employ in their offices. And there's a real trickle down sort of financial impact when an office closes, as all of you know. The federal government, as they did in a number of countries, launched some COVID support programs, and we advocated early and strongly to make sure that physicians would be eligible for those and provided guidance and support to them as well in that area. And here's a screenshot from our website, and it just gives you a sense of some of the areas where we've really been trying to push resources out to physicians. And you can see, so for example, managing your practice, maintaining yours and your family's well-being during a pandemic, reaching out to physician health programs at the provincial level, resources to share with patients, articles from our journal, resources around use of PPE, and then a large section on clinical resources on COVID-19. So this is a screenshot from relatively early in the pandemic, but it gives you a sense of some of the priority areas where we were trying to push out that information. And here's some of the content that we had around publicizing the launch of, for example, here the Physician Wellness Hub, where all these resources were put into one place that members could access to try and stay well. And then this physician health and wellness support line, which, as you can imagine, required a lot of intensive work and resources to make sure that that was properly staffed. And doctors have been making use of that during the pandemic. So again, this has been really a priority issue for us, and both through the direct support for physicians and members, as well as working on advocacy at various levels to ensure that the public and politicians have clearly understood the impact of the pandemic on our colleagues. Another big area of activity has been around the transition to virtual care. So essentially overnight, Canada, like many countries, went from a situation where we had a very small percentage of care that was being offered from a virtual perspective. You know, a small percentage, say 4 to 5% of visits were sort of being done virtually, primarily for people who were in rural or remote areas. As many of you know, Canada is a very big country, and not all of our patients are in an urban setting. So there was the use of virtual care for some of those types of situations, but it was really the exception rather than the rule. And then essentially overnight in mid-March, we had to shift the vast majority of care to the virtual realm. One of the things that had to happen very early on was we had to figure out how doctors were going to get paid for this. And that was one of the big barriers, you know, leading into the pandemic around why virtual care was not being adopted more fulsomely, was because governments were reluctant to step forward and pay for that. You know, they felt there was maybe a lack of evidence around the efficacy, the appropriate use of these types of care models. But obviously, you know, through necessity, we had to shift very quickly, and governments responded accordingly by figuring out how to compensate for that. We had actually just completed a year-long effort in conjunction with some other associations in Canada, where we had a virtual care task force that was set up and had released a report only a few weeks before the pandemic, outlining appropriate use and the types of supports that would be necessary for virtual care to become a reality. And so we were actually in a sort of reasonably good situation to help support our members. In fact, in March of 2020, just as the pandemic was really getting bad, we launched what we called the Virtual Care Playbook, which was targeted for physicians and really outlined sort of the principles underlying virtual care, the technology required, the appropriate use, the barriers, and ways to overcome some of those barriers. So that was just sort of by happenstance quite timely. The other thing that we recognized very quickly that was required was not just a guide for doctors, but a guide for patients as well, particularly, but not just elderly patients who may not have been as comfortable with technology. And so in June of 2020, we launched the Virtual Care Guide for Patients, which had extremely good uptake and was very well received by the public. And so here you'll just see some examples of some of the materials that we pushed out over social media and other venues around some of the issues that we were trying to address. So, you know, when should you use virtual care? When should you not use virtual care? Things like just, you know, really basic things like how to get ready, how to book your appointment, how to have your device ready, how to get your space ready, making sure that you were properly prepared. I think a lot of patients, you know, are certainly used to going into a doctor's office and they, you know, there's a routine that's followed. you check in, you see the nurse often, then you see the doctor, and they're not as used to that routine, obviously, online or on the telephone. And so trying to prepare them for what to expect was really important for our members so that they could sort of optimize the time that they had. And then these checklists before your visit, what to have ready, during your visit, what to do, and then after your visit. And again, the feedback that we received was that this was really very helpful because this was all new to the vast majority of the population. So even the logistics, could sometimes prove challenging. Another really important tool that we had was something we called COVID questions. And this was really in response to all of the information that was very quickly going online from, as you all know, a very wide variety of sources, some of them reliable and some of them very, very unreliable, and spreading misinformation. And so quite early in the pandemic, we and some of the other healthcare organizations in Canada saw a need to publish in real time information for patients and the public that was accurate and scientifically valid, that they could refer to and feel very comfortable that this was the right information and accurate information. This was reviewed by physicians before being published. It was focused on key and emerging issues as we went along, and also received public questions and feedback and responded to those continually as well. It really has become the go-to source of information for patients in the media. Thankfully, it's been kind of a one-stop shop for a lot of people who have questions where they would like accurate information that they know is unbiased and scientifically valid. And it's been in many cases a useful counter to some of the unfortunate misinformation campaigns that we've all seen. And so here you can see some of the publicity around the launch of this initiative, together with the Royal College of Physicians and Surgeons and the College of Family Physicians, a website where questions from the public will be answered by reputable sources. And then some of the copy around, how does COVID spread? Do you have questions about it? And so early on, these were the very basic questions. What is a virus? How do viruses spread? What is COVID? Where does it come from? How is it different from other viruses? How can I prevent it? What are the things I need to consider? And then, as time passed, we got into more things around vaccines, around return to work, all these types of things, around travel. So it evolved. The site has evolved and has stayed live as the pandemic has evolved. And so that leads us into all the work around vaccines that we've all been doing for the last year or so. And as for many healthcare and physician organizations, we started out by working with governments and decision makers to make sure that frontline healthcare providers were prioritized along with the high-risk populations, and worked with our colleagues to make sure that they were prepared to provide the vaccinations, to answer questions, providing accurate information to patients and the public, again, through COVID questions primarily. We worked with our nurse colleagues this summer when we started to get a lot of questions around obligations for physicians and other healthcare providers in terms of getting the vaccines themselves. And we came out with a very strong statement that supported mandatory vaccines for healthcare providers. Right now in Canada, we actually this week are in the middle of a fairly significant controversy in this area. As some of you will know, in Canada, healthcare responsibility for healthcare is at the provincial level. We have 10 provinces and 3 territories. And so it's up to each one of those jurisdictions to decide whether or not to make vaccines mandatory for doctors and nurses in their jurisdictions. Some of them have done so, and just this week, 2 provinces which had committed to make them mandatory at the last second backed down and said that they were concerned about the impact on the number of available healthcare providers, and that's caused a lot of controversy and a lot of politicization over the last 48 hours or so. And so we continue to work through some of those challenges, but we have been very vocal about the need for doctors and nurses and other providers to get vaccinated. Another big issue here as elsewhere has been around the issue of what some people have called vaccine passports or vaccine documentation. So, for example, tonight I went out with my family to a restaurant and had to show proof of vaccination to be able to eat at that restaurant. And the same is true in all parts of Canada for pretty much all indoor activities, except for shopping and things like groceries and pharmacies and those types of things. But for sporting events, theater, movies, restaurants, entertainment, gyms, anything that's sort of discretionary, you do need to show evidence that you've been vaccinated. The other issue that's quite tricky from a political perspective, but is important for a table like this, where we're all very concerned about global health, is the issue of global equity and distribution. We all know the statistics around where the vaccines have been distributed and where they have not. We know the controversy around the provision of boosters in a lot of jurisdictions, including my own, before many countries in the world get access to a first shot. And so we have been vocal, both in public, but especially behind the scenes with the Canadian government, to continue to encourage them to share and to provide funding for vaccines in countries outside of Canada. Our Prime Minister at the G20 announced a significant donation. Certainly more needs to be done, and we continue to make that point again in public and in private. Another area where we've had an opportunity to have a bit of an impact has been around funding and support. So about 3 years ago, we sold a financial subsidiary company that we had owned for 50 years. We sold it to a major Canadian bank for about $3 billion Canadian. And so we are sort of in a unique position for a nonprofit we've established a Canadian Medical Association Foundation that's very well funded and supported, and very quickly turned to the foundation to disperse some of that funding to the medical community and to vulnerable populations throughout the pandemic. So we've distributed over $30 million in funding. And we also, of note, earlier in 2021, when the devastating wave was hitting India, we saw the terrible impact it was having on our brother and sister colleagues on the front lines in healthcare in India. We wrote a letter of support to the Indian Medical Association, and also donated $250,000 to Médecins Sans Frontières, specifically towards their response in India to try and remove some of the pressure on the front lines that our colleagues were facing in that situation. And so we've tried to respond as we've been able to some of the challenges. And this next slide just gives you a bit of a sense of where some of that $30 million has gone. So, for example, to hospitals, to provide PPE and clinical equipment. So early in the pandemic, we did try and provide funding to get PPE to Canada for our members. We've given a lot of money to learners and junior colleagues, cities and communities, family medicine, frontline workers, et cetera, et cetera. So, we've really tried to leverage some of the resources that we're fortunate to have to try and support folks on the front line and make a bit of a difference in that way. One of the real challenges in this area, and I sort of alluded to this earlier, around some of the efforts that we made to sort of counter disinformation and get information out to decision makers, has really been trying to leverage traditional and social media to advance our advocacy priorities. It's been really fascinating in Canada and elsewhere to see the role that both individual doctors and the collective profession have played in terms of social media and advocacy. And there are a number of Canadian doctors now who are considered national celebrities who no one had heard of 2 years ago prior to the pandemic, because they really stepped forward in terms of challenging governments and other decision makers and making sure that public health is prioritized ahead of political expediency. So, a number of situations have occurred, for example, where provinces have tried to open things up and have faced significant backlash from us and from individual doctors and collectively the profession around that, and have had to backtrack and reinstitute health measures like masking and social distancing and limiting attendance at different events. And it's really sort of showed the power that physicians have when they leverage it wisely, and when the public is paying attention. We all know that in many situations the public trusts physicians a lot more than they do politicians, and we've really seen the impact of that over the past few months in Canada and elsewhere. And just quickly, a few of the statistics, just to sort of show you, the uptake that we've had in terms of the reach of our sort of social media efforts, and the increase that we've had in terms of, for example, over, almost tripling the number of Facebook followers, 4 times the number of Instagram followers, and a lot of traction on those social media platforms. So we've certainly tried to be active in the areas where our members and where the public are looking for information. And then this gives you a sense of the uptake in terms of traditional media. And just to, as a good example, in 2020, we had, almost 700 million impressions, and then double that just in the first 9 months of 2021, as increasingly, doctors and the medical profession have really been the focus of a lot of media attention during the COVID pandemic. So while it has been a truly awful time, it's provided an opportunity for organizations like ours and for physicians to step forward and really show leadership. And the public and the media have really taken notice of that and have spent a lot of time amplifying those voices. This is finally here in terms of the media part. We undertook a vaccine hesitancy campaign through the COVID Questions website, and you can see the number of page views and the increase in traffic by 1,400% in the first month alone of that campaign. So really very significant uptake in terms of a lot of the social media and online campaigns that we've been undertaking. And then I'll just sort of close here by just identifying things that continue to occupy us as we move forward. We've been very clear that this is not going to stop anytime soon, not just in terms of the pandemic and sort of this idea of moving into an endemic phase, but in fact, the repercussions from the last 20 months or so are going to be profound and long lasting. The impact on physician and other healthcare provider health and wellness is not going away anytime soon. It has really highlighted here and elsewhere profound concerns around health human resources. We were under-resourced and underfunded when this pandemic started, and we are even in a worse situation at the current point in time. And so that's going to be an area of focus for a long time. As you know, the United States just this week approved a vaccine for children under the age of 12. We anticipate that Canada will follow before the end of November. And so there is a lot of work going on in the background to ensure a successful launch of that campaign. As you can imagine, lots of conversation around vaccine hesitancy on the part of parents, even parents who would get vaccinated themselves may be reluctant to consider it for their children. So we are working hard to prepare for that. And then, as we all recognize, there's a tremendous health services backlog now, thousands and thousands of surgeries and interventions that have been put on hold because of the pandemic. That is going to take years for us to clear, that will also have significant impacts on health human resources and physician health and wellness. And so the story of this pandemic will continue to be written for a long time to come. Hopefully, I'm going to stop sharing here. Hopefully that was a helpful overview. And I've just tried to sort of highlight some of the key issues in Canada and some of the ways that the CMA tried to respond. And I'm certainly happy to answer any questions. Thank you very much again for the invitation, and thanks for your attention.
Thank you, Dr. Jeff. And it was definitely a very good insight for what Canada has done. We will now open the forum for question answers. But before that, I would just like to quickly introduce everyone in this forum. So we have received regrets from Singapore. We have received regrets from Dr. Heidi. Meanwhile, we would like to introduce, usually people who attend these sessions are Dr. Heidi. She's a president for the World Medical Association. Dr. Chong, he's a chair for SIMAO, and he's from Singapore Medical Association. They both are traveling. Dr. Ravi Naidu from Malaysia, Dr. Nazmi from Pakistan, Dr. Alvin from Hong Kong, Dr. Pillai from India, Dr. Salma Kundi from Pakistan, Dr. Angelica from South Africa, Dr. Jamaluddin Chaudhary from Bangladesh, Dr. Akhtar Hussain from South Africa, Dr. Mukti from Nepal, Dr. Subramaniam from Malaysia, Dr. Sajad from Pakistan, Dr. Prakash from Nepal, Dr. Bennett from Philippines, Dr. Deborah from Brazil, Dr. Marie from Japan, Dr. Russell from Bioethics, UNESCO, Australia, Dr. Qazi, President-elect SIMAO from Pakistan, Dr. Sheen from Korea. We also have Dr. Shashank Joshi. He was an instrumental for COVID task force in India. Dr. Bukhari from Pakistan, Dr. Monica from USA, Dr. Sanchita from India, IGCP group, and I am Saurabh from Heartcare Foundation of India. So can we have questions?
Saurabh.
Yes, Dr. Sajal.
Yes, thank you very much, Saurabh. I just very much impressed with the presentation of Dr. Jeff. Very informative and very impressive, Dr. Jeff. Well done. Actually, I would like to know that the Canadian Medical Association did a wonderful job during pandemic, as you said. I just want to know the office bearers are they working for honorary basis, or they are working on a salary basis? Number one. Number two, about the vaccine. What about the boosters vaccines? Are they healthcare workers are having this booster vaccines completely? Are they in favor of booster vaccines? What is the situation in Canada? And as you said, in Pakistan, the Pakistan Medical Association, same as you did in Pakistan, we provide the PPE to all the healthcare workers. I mean, the paramedics, the nurses, the doctors, and even the other staff, the administrative staff, everyone. The Pakistan Medical Association have provided the PPE. So, lastly, I must have your contact or the contact of the Canadian Medical Association, so that we can collaborate from Pakistan Medical Association and the Canadian Medical Association to exchange our views frequently, and we can just have, maybe I'm visiting Canada in within 6 months, so we can visit the Canadian Association and learn something and get some guideline from the Canadian Medical Association. Thank you very much, Dr. Jeff.
Thanks very much for your comments and questions. I just put my email in the chat there, and you can certainly easily get a hold of me that way. Always happy to collaborate with colleagues. I'll just answer those questions. So in terms of the senior office holders, we do provide them with an honorarium that often sort of approaches, I would say, salary replacement, essentially. Some of our elected officials take the year off entirely from clinical duties, and some of them still continue to practice a little bit on the side. But we certainly try and make sure that it's not a financial burden for them to assume the office. Again, we're a little bit fortunate in terms of the resources that we have. And I see your question about the guidelines on telehealth. In terms of the boosters, that's a really good question. Again, it's there's a significant controversy around this issue of providing boosters in resource rich settings like Canada, while a number of other settings don't even have first shots. And so I would say there's still sort of mixed opinion on this. Certainly that's probably true in healthcare as it is in the general public. However, the rollout is happening, and high priority populations are being identified, and certainly healthcare providers are amongst those populations. So I would anticipate that a number of physicians will get boosters in the next little while. I think there's a lot of discussion around how can we, at the same time as we try and look after our own populations, how can we do a lot better and a lot more at the global level? And I think that's where we're turning a lot of our attention at this point. So it's not an easy answer. I think we're trying to find a solution that addresses all of those issues, recognizing that we have a long way to go.
Okay, one more thing. I just take an advantage. Do you have any knowledge about the vaccine, which is in the form of tablet by
Did we lose the connection?
Yeah, I think we lost him in the virtual meeting, the benefits and the disadvantage of being on the virtual meeting. So,
okay. And I think it was a question around a vaccine in tablet form, and I don't have any insights into that.
Yeah, okay. So meanwhile he joins, do we have another question? Dr. Jeff, can you cover something on the vaccination for the children? And is there any, I heard there are specifics in terms of new diseases coming in, new issues coming in for the children. There are some, infections across Canada. Anything on that front?
Yeah. So they just announced today, the Public Health Agency of Canada, that the majority of infections now, of new infections, are in children under the age of 12, and that's the first time we've seen that during this pandemic. As you know, thankfully the impact tends to be much lower, of course, in the pediatric population. However, we are still seeing severe cases in up to 1% of children, and obviously they represent an important vector in terms of transmission to more vulnerable populations. So we're definitely seeing an increase, which is not surprising because they're an unvaccinated population and they're going to school. Schools are pretty much all open in Canada. In most places, kids do wear masks, but still, younger kids especially don't always keep those on. And so there's been a lot of attention paid to, the possibility of vaccinations in that population. I spoke to someone from our public health agency earlier this afternoon, and they indicated that they were hoping that the review process would be complete before the end of the month. We're anticipating that will probably be the case. And certainly Canada, I can tell you the government has consistently indicated they're ready to roll out the vaccine. They have sufficient supplies for the pediatric population. So I don't think it will take very long for that to happen.
Yeah.
Thank you, Dr. Jeff. Can I ask one or two issues? The mandatory vaccine only for healthcare worker. Why not the other vulnerable groups? That's the one. Second one, is there any choice of vaccination that healthcare worker can choose which vaccine they want? Or is it mandatory to just take one vaccine? Thank you. Over to you.
Thank you. Yeah, thanks for those questions. So I mean, we've certainly focused on healthcare providers, because that's our remit, of course, and our population. But we've also, so for example, we've been quite vocal around, for example, in the school context, having teachers and staff, mandatory vaccinations in that situation. The other thing that our stance has done is it's provided political cover for the federal government to insist that all federal employees be vaccinated, which is many, hundreds of thousands of people. And so even though that's not sort of within our sphere of influence necessarily, by us coming out and taking a strong stance with our membership, it's allowed other parts of the other sectors in society to do the same with their own. So that, I think that's been really helpful in terms of just moving the needle on the mandatory sort of nature of vaccinations. We've seen the same in the US as well, where the AMA really came out very strongly along with a lot of the other organizations. And then Biden was able to sort of follow behind that and issue mandates for other sectors. At the moment, right now, people can pretty much pick and choose their vaccines here in Canada. It's really pretty much Moderna and Pfizer. We did have a few doses of Johnson & Johnson, but I'm not even sure if they ever got administered. And then I don't know where things are with AstraZeneca. It sort of got put on hold with some of the side effects and complications. And I think, now that we're in a situation where supply is sort of greater than demand, people can pretty much choose which vaccine they want, which I recognize is a bit of, we're pretty fortunate to be in that situation.
Dr. Angelica, you have a question?
Thanks so much. Jeff, thank you so much for your presentation as well. I tried to look on your website to see where the e-health thing is that you have presented to us, but maybe I'm not sure where to go in there because I couldn't find it. So that's the one thing. But I want to actually ask a question around the children. I know that there's a higher incidence that we are now seeing around the children, but would it be more with severe disease? Would it be more children that is already been compromised with chronic diseases or other immune diseases, that they are more likely to be fall in the group of severe disease? Or doesn't it matter? There's not really a trend that one can see with children with severe disease of COVID. Doesn't matter whether you are healthy or not. Is there anything there that you could have picked up? We haven't seen that yet in South Africa as a problem, and so I just would like to learn from the guys who are seeing more children getting severe disease. Thanks.
Yeah, thanks for that. And listen, if you send me an email with your contact information, I'll make sure that I get those resources to you, and happy to share that, of course. In terms of the kids, I think we're sort of like you. The suspicion, of course, based on what we've seen with adults, is that kids who are immunocompromised are more likely to be on the more severe end of the spectrum. My impression, without knowing the data in depth, is that the numbers are still too small, which is a good thing, too small to draw any definitive conclusions at this point, which I think is probably sort of consistent with what you folks are saying, even though inherently it sort of makes sense that there would be a risk profile that would not be dissimilar to adults, but I haven't seen definitive proof of that.
Thank you. Anyone else has a question?
Saurabh, I think
Yes,
I have lost the connection.
Yeah.
Okay. Dr. Jeff, I just want to know that the Pfizer company has launched a tablet vaccine. Do you have any, can you comment on that? They claim that this tablet vaccine for corona is 98% efficacy. What do you think about that?
Yeah, so I'm not so. I know there's a tablet. It's not a vaccine, but it's a treatment. It's a treatment within the first 5 days of illness, so very early on, and it's a combination antiretroviral. And I think I saw today something like 91% reduction in hospitalization and severe disease. And I'm not sure about a tablet vaccine, although there was a note in the chat that there may be a tablet in a phase 1 trial. The Pfizer treatment, the first information we've seen about it, though, was just in the last day or two. There is an antiretroviral tablet that's been approved in Britain that was not as impressive in terms of the results, but still did show a decline in hospitalization and severe disease. So I suspect that we're going to see a lot more emphasis on not just the vaccination piece, but the treatment over the next few months, because there's obviously some antiretroviral combinations that are proving fairly effective. And if they can cut down hospitalizations to that extent, they're going to be extremely impactful just in terms of the financial aspect as well.
Okay, Dr.
Okay, thank you very much. One more thing I would like to know. Dr. Pillai, just please, thank you very much.
Yeah.
I just want to know in Canada, Dr. Jeff, can you say do you have any data about the death of the healthcare worker? Rather, I can say the doctors. How many doctors expired in Canada during this COVID-19 during their duties? Do you have any idea?
Yeah, no, thanks for that question. We don't have definitive data. I would say the numbers, thankfully, are quite low. Maybe even lower than during SARS, because we saw the impact on the healthcare profession during SARS, and I think a lot of physicians were sort of extremely sensitized to that and spent a lot of time sort of preparing and protecting themselves. We don't have good federal data. I can tell you that the numbers are very, very low, though, especially compared, unfortunately, to some other countries.
Actually, I asked this question because the doctors who have been working in Corona ward, the doctors, those who are treating the Corona patient, they are very less number have expired, and mostly the doctors who expired in Pakistan, they belong to other specialty. Like me, as a ENT doctors, the anesthesiologists, the general practitioners, the eye surgeon, dentists, and the other. Because what we have perceived that they are they are exposed more. They cannot diagnose the patient is coming to us with ENT problem, but he has or she has a virus also. So they take the virus and then get severe and then die. So in Pakistan, we unfortunately 229 doctors have been expired.
Wow, that's tragic.
Okay, thank you very much, Dr. Jayat. Dr. Pillai, please.
Yeah,
I'm sorry for
Dr. Pillai from India. It was a very informative talk, and it does give us a lot of lead as to how to go about further the control of COVID. What is the percentage of the population who had both doses of vaccine in Canada? What percentage?
So what's the
percentage of population had full vaccination?
Full vaccination. It's very high. It depends a little bit on the province, but in most provinces, it's at least 80%. and more often probably closer to 85. I'd have to look at the most recent numbers, but I'd say it's probably around 85% who are fully vaccinated. Now that's 85% of eligible people, so ages 12 and up. In terms of the total population, it's about 74%. But still, we're very fortunate that it's so high.
So now, what is the number of cases you have? COVID cases.
Yeah,
Do you still have?
We do. They're quite low. They're not as low as they were earlier in the year, but they are around 20. The incidence is around 20 per 100,000 or so right now. So quite low in terms of the the global perspective.
Present infection, is it by Delta variant or any other variant?
Yeah, it's primarily Delta now. It's really become, there was a wave of Alpha in the spring, but right now the primary variant is certainly Delta, and in the kids, it's primarily Delta as well.
This COVID appropriate behavior, the people, are they still following it, or it is all open?
No, it's pretty good. Canadians are good rule followers by and large, and we're sort of like New Zealanders in that way, and other populations. We listen mostly to the government and try and sort of be considerate of each other, and so the behavior, with pockets of exceptions, has been quite good. The public health restrictions are still reasonably tight. Everywhere requires masking indoors. And everywhere has COVID passports or vaccine passports in place, and social distancing in place. And again, with a few exceptions, I think people are following the rules pretty carefully.
Other diseases, has it gone up, or the death due to other diseases gone up?
Yeah, it's a good question. There's some indication that that's the case, but it's probably too early to tell definitively. There's certainly concern around, for example, delays in diagnosis of cancer and coronary artery disease that are leading to upticks in those areas. But it's hard to know whether those are artifacts or whether it's a true trend. And I think the next few months are probably going to give us a little bit more information, but certainly it's a concern.
Thank you.
You're welcome.
Jet, any comments on artificial intelligence? I know Canada has been known for artificial intelligence and in various fields. And I also know they have implemented a lot of AI in the COVID data, COVID analysis, and to overcome whatever the waves, the future waves and future thing. Any comments on that?
Yeah, just as you say, I think the real use of AI during the pandemic has been in the modeling. And that's been helpful because I think the first thing we had to do was help the public understand that every model is wrong, but some of them are more useful than others. And what it's really shown people, and it's been helpful in that we've actually been able to show that the modeling was reasonably accurate. You can show them with a certain percentage of interactions, this is what the cases will look like, versus if you can keep your interactions below this percentage, the cases will drop down below this. And again, we've been able to show historically, now that we've got 20 months of data, that in fact the projections were reasonably accurate once we've been able to track sort of interactions and case rates. And so when the politicians and the chief medical officers now go out to the media and say, we're concerned because the AI is showing a projection that cases are going to get worse, people actually listen to that now, and it does seem to impact behavior. So that's been helpful, and I think it's been a good example of the power of modeling and of AI for something like this.
Thank you. And I also know, like during this pandemic, which is true for all countries and all regions, but Canada being a very large, very less densely populated and a very large country, there was a bigger risk of being isolation, among especially the seniority of a lot of people there, and obviously, losing the incomes and everything. So there was a lot of, what do you say, mental level stress going on. So any like if there are any comments on how CMA were able to instrument, in uplifting the social welfare for the people there in Canada.
Yeah, it's a good question, and as you know, I mean that's been a concern, of course, pre-pandemic as well, is social isolation and the impact on health, and certainly the pandemic has shone a light on that. Like other jurisdictions, we've really struggled to keep folks in long-term care safe, especially early on in the pandemic. That's where, unfortunately, the majority of deaths occurred, was in the long-term care setting. Amongst frail and senior folks. What we've learned is that we need to do a better job of leveraging all sorts of different interventions in terms of the social isolation. And so coming out of this, that's going to be one of our strategic priorities around care of the elderly, is the use of technology, but also social resources and social supports in keeping elderly folks connected and safe. And because I think, we didn't do a very good job during the pandemic, and it's something that we need to improve a lot on coming out of this. The government, did do a reasonably good job in terms of the financial piece. So not just supporting people, who weren't working or whose businesses suffered, but also providing financial support to elderly persons as well, so that they were able to provide for the necessities and that type of thing. But the social isolation continued to be a concern.
Thank you so much. That answers a lot of questions. And there, anyone else has a question for him? Jeff, I would request you to also attend future meetings wherever you're available. This is the same time. I know it is very late for you, but we have a chance where we all CIMAO countries meet, and we've seen a lot of interest coming in from the non-CIMAO countries as well. And there's a very good chance to understand what's going on. Obviously, this is at the stage where a lot of countries are at a very cool and very stable position. But during the pandemic, these meetings were very, very important. So I do invite officially where you can be a part of those meetings as well. Every Saturday it happens on the same time. And this is the 83rd meeting. We also have country updates, which happen usually every week whenever we have time. In case the presentation goes long, we carry forward. So we still have about 10 minutes. We can cover up quickly, what's going on. Yeah, Dr. Wazi, you're saying?
This is Dr. Wazi. Thank you, Sarab. And thank you, Jeff, for your excellent presentation. It was wonderful listening to you and getting all the updates and how to proceed. And it was wonderful. You did a great job as Canada Medical Association. And I must appreciate and thank Sarab for carrying on this weekly meeting. It's an excellent platform where we get all the information updated from around the world. It's wonderful, your dedication, your hard work. We really appreciate, Sarab. And I'd like to thank all the participants, those who are there, taking keen interest, and their questions really, open up the topics, and that's how we come to know what is happening around the world. So I think we must keep this weekly meetings going on. And as you rightly said, Jeff did an excellent presentation, and we'd like to have him regularly on this forum as well. So, the COVID was covered very nicely during these weekly meetings. and everybody got the the latest and updated knowledge of its management and the researches going on and the upcoming efforts by the scientists that may help us in getting onto the life in a better normal life or a new normal life in near future. So thank you very much for your efforts, Saurabh,
Thank
and
you so much.
excellent, this platform for all of us.
Thank
Thank
you. So can we also have
Saurabh,
quickly update?
Saurabh, I just add what the Dr. Qazi said. This is all because of my dear friend KK Agarwal. We must appreciate, and we just definitely we can't forget him, KK Agarwal, who have started, and this is all his vision. And I appreciate, Saurabh, that you are continuing the vision of and the meetings of CMAO every week. So again, the credit goes to KK and you also. Thank you very much.
Thank you. So can we quickly start with an update on Pakistan? What's happening with Pakistan?
Okay, in Pakistan, thanks God, we are having everything normal in Pakistan. The school, the restaurant, the market is in normal condition, and the cases because of this, the cases is going down. We have only in within 24 hours 11 cases of death, 11 deaths, and only near about 500 cases all over Pakistan have been registered during 24 hours. And the vaccination, the 52% people in Pakistan have been vaccinated till today. And the situation is good, but we as a Pakistan Medical Association have been advising the people that please do follow the SOPs because it will again come if you are not following the SOPs, and please get vaccinated as early as possible. So this is as a PMA activist, we are doing this campaign through media, electronic and the print media. The situation is good, and I hope that the world will soon be eliminated from the COVID virus as the people are doing. But some people and some percentage all over the world is very hesitant from the vaccines and as well as not following the SOPs. So this is a problem for all over the world. Thank you.
Thank you. Anything to add, Dr. Wazi?
The 52% Dr. Cassis Sajad has talked about is the single dose, but the complete dose, meaning 2 doses, is around 25%. Anyway, but talking about a population of 220 million, and it's getting better. The positivity rate is quite down. It's around 1.2% throughout Pakistan, and the death rate is also, as Sajad has pointed out, is very low. So in a population of over 200 million and only 11 deaths, things are getting better, despite the fact that we have low vaccination being done. And there are no SOPs followed, despite the fact that the health authorities, the PMA, and everybody is trying to, convince the community to follow the SOPs. But still, we are doing good, and everything is now opened up: schools, colleges, markets, and all that. But let's hope that we continue to have this low stage of new cases. And one thing I just always thought of, that let's have a mutated virus coming up in future, which could have, faster spread, but lesser virulent and lesser toxic, so that we can have, the better or the best herd immunity by that low virulence, low toxic virus. So anyway, things are moving in right direction. Vaccination, although is low, but still we are doing good at the health sector.
Thank you.
Thank you.
Can I invite Dr. Pillai from India to give an update?
Thank you. India also, COVID is under control, definitely. The number of cases come down to 12,000. And this again, only in certain states. And micro confinement definitely is continuing in areas where the incidents are more. Otherwise, the society has become open. Schools are open, industry, business, houses, tourism, everything is slowly returning to normal. And of course, the precautions are being taken. Air travel and even state-to-state travel, you have to do PCR and so that you don't have an infection. And to that extent, the spread definitely has been controlled. And Covaxin has been now recognized by WHO as an emergency vaccine. And there's a great boost for India and for Indians to travel to other countries, particularly those who have taken Covaxin. And otherwise, things are settling down. Even the latest variant, AY42, in only one state, few cases have been detected, but then further increase the number has not taken place. And then, of course, a good news in the horizon is that oral medicine produced by Pfizer has got approval in England, and hopefully that can prove to be a solution. Particularly, it happens to be an oral tablet, so things are getting brighter. But COVID-appropriate behavior has to be continued. Vaccine definitely now almost 1 crore or 1.1 crore people have been vaccinated, and vaccination process is going on well, but still there is some amount of hesitancy for the second dose, for which the medical profession is definitely doing its best to see that at least 2 doses are taken by all. But then silent infection definitely increases the antibody percentage in the population, which varies from 60 to 85%. Thank you.
Just one question coming out. I don't know if Dr. Pillai can answer, or we also have Dr. Arun. India is like, we have seen in winters, we usually have a lot of pollution problem. And during the COVID, people have seen a lot of issues with the lung. So is pollution causing, for a long COVID, is it causing more severe problem for people who have COVID and had a severe disease of lungs? And is it affecting more? And will that, if somebody is having a COVID right now and suffering, in this pollution level, so what's the correlation? Is there any answers for that?
Of course, Dr. Joshi is there to answer it still.
I just saw Dr. Joshi, but I
comment.
think he's just missed out with the connection, I believe.
Okay. What I can say is definitely air pollution adds on to the problems with COVID, but wearing a mask, appropriate masking, definitely is a solution. And the government has taken a lot of steps to see that pollution is down. But because of the Diwali celebration and the crackers, maybe temporarily for 2-3 days, the air pollution has gone up, and we hope it will come down, and it's not going to be a permanent problem. Even burning of hay and other things in the paddy fields, a lot of restrictions have been brought out. methodologies are being used rather than burning it. And industries, definitely precautions are being taken regarding the exhaust air and the steps taken to control pollution, air pollution by the government and the cooperation of the people. This can be overcome. And the present high level in Delhi is mainly because of the Diwali celebration, and it will settle down maybe 2 or 3 days.
Absolutely. So I think there was a news which says pollution has actually hugely affected the respiratory health systems of the people with the lung disease, and people should wear masks. That is the only way to help during COVID and pollution. And it has led to several cases of COVID as well. So can I have South Africa, Angelica and Dr. Akhtar Hussain to give an update?
Sorry, just trying to unmute myself. I will leave the data to Dr. Hussain, but just want to briefly tell that from next week, our healthcare workers who received Johnson & Johnson in February this year will now be due for a second Johnson & Johnson booster. It will start sometime next week. The date is the 8th, but I don't think we will start on the 8th. And it's around about 500,000 healthcare workers, and we're trying to get them vaccinated before middle of December, as we expect our fourth wave to maybe start during that time. There's a bit of unhappiness currently because we, in the beginning of the year, the only way that we could have gotten any vaccines was under what we call the Sisonke trial, that was with Pfizer, with Johnson & Johnson, and they were donating then at that stage Johnson & Johnson to South Africa for healthcare workers. So that we then got that vaccines under that trial in inverted commas. So what now happened, again, we were waiting for the data to come out to prove that with Johnson & Johnson, you need a second dosage. Unfortunately, the data only became available the last 2 weeks, as simultaneously with the heterologous vaccines that also can add a lot of value. And South Africa has got at this stage Pfizer vaccines. So again, at this stage, we were told that we will go under Sisonke 2 as a trial again. And therefore, we cannot take Pfizer. We don't have a choice. Our choice is either you take Johnson & Johnson or you don't vaccinate a booster. So we're a bit unhappy about that, and we're still trying in the background to see how we can lobby government to allow the healthcare workers, for those who want Pfizer as a second booster, to get that. And not only Johnson & Johnson or nothing else, because there were doctors that had adverse reactions on the Johnson & Johnson, and currently there's not really a choice for them. And I think that was why Dr. Akhtar also asked that question earlier regarding the choice, and we think we should have a choice. Thank you so much.
Thank you, Angelique. In South Africa, the situation is much better. Is any other country like decreasing the cases? We have last 24 hours 339 cases, and the death was 44. But these are the death included chronic admission with the COVID. Our recovery rate is 96.3%. Still, we got 18,000 active cases, and we have got total positive COVID-19, 2.9 million. Our total death till now is 89,295, and recovery is 2.8 million. The good news is some of the hospital discharged their last patients yesterday and day before yesterday. So the admission of the COVID is less and less. I just like to share the death of the healthcare worker. One of our previous speaker, Dr. Sajjad from Pakistan, mentioned. In South Africa, we had total more than 1,300 healthcare worker death. And those healthcare workers, not only the doctors, is nurses, the porter, the cleaner, the surgical team, the specialist, the professor, and the most of the death is happen like 60.8% death had a comorbidity, and the 30% of the death of the healthcare worker is more than 2 or 3 comorbidity. And this pandemic, we have 9,000 healthcare workers was admitted in the hospital, and their most of the age factor was more than 40 years of those deaths. And we, in this pandemic, we have lost plus minus 20 professor of medical profession, especially from the medicine and the other domain. So that was our statistic. Thank you, Sharab.
Thank you. So thank you, everyone. Dr. Jeff, we would like to just have a last question from you. I understand in America, in US, there were a lot of revolt or backing out for the vaccination among the healthcare workers. Is that something which happened in Canada? And before I can ask for that, we also have Dr. Karl Chai Ko, I believe. Can you have? I just saw from Malaysia. Can you please introduce and give an update from Malaysia?
Yes, I'm Dr. Ko from Malaysia. I'm the Vice Chair of CMAO. Well, Malaysia, the latest statistics on our population who is vaccinated, adults, we have totally, who have received 2 vaccinations, about 95% now. And children between ages of 12 to 18, we are touching about 60% of vaccination. So the number of cases in hospitals are dropping. We just hope that it will remain so, or even drop even further. So the active cases in Malaysia, sad to say, we are still touching about 4,000 to 5,000 per day at the moment. And we still have got death cases coming in. And as of yesterday, we still had about 40 over death per day. Of course, it came down from 100 plus, 200 plus over the past week or so. So overall, I think the picture we are seeing here is that there is actually an improvement due to the vaccination. And we are now embarking on booster doses for our frontliners and the those elderly as well as immunocompromised. And our stand in Malaysia is that for those who have been vaccinated with Sinovac from the Sinovac vaccine, 3 months post second dose, we are giving them a booster dose of Pfizer, that is heterologous. And then for those who have been vaccinated with 2 doses of Pfizer, we are now giving them a booster of Pfizer up to 6 months. As for those who have been vaccinated with AstraZeneca, there's no guidelines on that yet. So for Malaysia, these are the 3 vaccines which we have. Thank you.
Thank you so much. Yeah, Dr. Jeff, would you like to answer that question before we wind up the meeting?
Sure. Yeah, thank you. Thankfully, we've seen relatively low vaccine hesitancy amongst physicians and healthcare providers here. Unfortunately, of course, even a small number is too many, and the very few physicians who have spoken out against vaccines tend to get a lot of attention. So even though it's a very, very small number, it probably appears larger in the public's view. We don't have really good sort of national data in terms of percent of uptake, but when hospitals have come out with their individual data, generally for physicians, it's between 97 and 100% uptake for physicians, a little bit lower for some other healthcare workers, but still quite high. Although again, I think anything less than 100 is really unfortunate.
Okay, so with this note, thank you so much. I really appreciate your time. I know we have brought you as a speaker, but this time zone is like a problem. But yeah, I really appreciate that you're like, it's a midnight over there in Canada, I believe. So I really thank you for bringing up time and giving us an update on what's happening in Canada. And I
My
also,
pleasure.
yeah, are you saying something?
No, it was my pleasure. Thanks.
Thank you so much. We would request you to be a part of these meetings at least once with a week. And with this note, we would like to end this meeting. See you again next week. We will bring more topics. In the future topics, we are trying to bring even the legal aspects of what's going on. We might bring a medical negligence during COVID, what happened as an international thing. So those topics we have covered, we will cover. We have brought nutrition as a topic before. We will bring those topics again. So it's not only the medical aspects we have covered we have covered everything, all angles of what happened in COVID. And these are interesting meetings. So we would request everyone to be a part of this meeting. With this note, we would like to thank all our participants, guests, and all our member associations. Thank you so much. See you next week again, same time, same day.